Welcome back to a guide to surviving a stroke or brain injury. This is going to be really difficult for me because I'm embarrassed. But I believe, and my niece reminded me, Kelsey, hello. She reminded me that people would like to see a day in my life kind of thing. Some of my routines. So I'm going to start off with first occupational therapy, and then I'm going to talk about stroke emotionals. So here it goes. So when I first had the stroke, I was right-handed, and my whole right side was paralyzed. As you can see, I'm kind of shaky still on this side. I'm really shaky, but I keep telling myself I'm not. But anyway, so my hand was clutched, and it was like this. And I could barely open it up. I had to force open my hand in order to do things. I was still in a wheelchair at this point, and in my opinion, physical and occupational go hand in hand. Because without the other, you can't accomplish the other thing. So what I started off with, I pried open my hand. And yes, this is a Dallas Cowboy sock. Don't give me any hate if you're not a Cowboys fan, but I am. But I started off with armbands. I didn't have a sock. I had bands that stretched. So I'm using this sock as a demonstration for the bit that I used. So I took the band, and I had a right side stroke. So I put it on my left side because the brain, I had a left side stroke, so it affected my right side. So I want to start on my left side, if that makes any sense, because that was the side that is affected in my brain. And crossing over helps tremendously because your brain rewires itself to notice that. So what I would do is I would unclench my hand enough to get around the band and do this. And it's so simple because I could do it when I was watching TV, just sitting on the couch, in my wheelchair, in bed, whatever. So this is a great way to start off, is just taking the band and going from, picture your right hip, or your left hip, I'm sorry, and just pulling it at a diagonal, like this. And I did this every day, 3 times a day, until I can do this now. I'm so proud. And always remember to celebrate every victory. Even if it's just one time you did it, that's awesome. Tomorrow it may be 2. You never know. Just keep trying. So, I'm a little bit more advanced because I've been doing physical therapy for 3 years now, occupational therapy. But these are some of the things that my occupational therapist gave me to do because I had a really hard time with fine motor skills. And I just want to show you. It's so sad. But this is what I used to be able to write like. And this is what I write with my right hand now. And trust me, it's pretty bad. Hope you can see that. But I put dates on it, and I get shaky sometimes, and some days are great that I can write well. Other days, not so much. I can't stop the tremors when I write. So that has to do with fine motor skills. So my occupational therapist gave me tools to increase that. And I'm happy to say some of them worked. So we're going to go through some of the occupational things that I have still. And I do every day. So this is a regular clothespin, and it's to get to this point where you can touch all your fingers. And this took me forever to do, and I still don't do it well. because these two fingers want to stay together for some reason, but I don't know. So she gave me the clothespin. So with the clothespin, at first was clipping it to something, anything, but just opening it is hard. It's like I don't have strength in this hand anymore to do anything. So I would clip it to whatever, was available. I used my dresser, and I had probably 10 of them. But I gave my other clothespins to my friend Cindy because she had the clutch hand too. So I gave her my bands and my clothespins. But anyway, so now this is what I do now with the clothespin. Each finger, I try to open it. See the strength? I don't have the strength that I used to. And this is super, super hard. I mean, for other people to see it, they go, no big deal. But for me, it's hard. But any clothespin will work. This is one that my occupational therapist gave to me. So thank you, Sarah, if you're listening. And she also did the following things with me. So the next is this putty. It's called Therapy Putty. And there's a lot of things you can do with this. Let me get it soft first. But always use your affected side. So if your left side is affected, use your left. No cheating, because the only person you're cheating is yourself. And I mean that, because I thought about that sometimes. I'm like, well, I'll just do it with my left. No. You have to do it with your affected side, so it'll get strength and posterity and posterity. My brain was affected too with the stroke. So, forgive me. But you can regain strength and dexterity. That's what I'm thinking of, dexterity. So, now it's kind of mushed. So, push down, which is very hard. With your affected side, always with your affected side. And then take and pinch. It's still too hard for me, so I'm going to have to... I know I'm cheating with my left. But for this video, I'm going to show you. Okay, so pinch and pull. Okay, you get the gist of that. The second thing she had me do, I keep all my stuff in this, but the second thing she had me do was put these little beads, and you can use anything small. I've used coins, I've used I don't even remember, it's coins and beads, but you push them in. Into the putty. Like so. And then you try to take them out with your affected hand. So the point of this is there's a little resistance picking them up, and also it helps fine-tune the fine motor skills so you can pick it up. Now, Oops. Okay. And there's a whole bunch of things. This came with things you can do with it. I totally recommend you getting therapy putty because it really, really helps. So the second thing I'm going to show you is she gave me a pipe. And what this does is it's tied at one end. See that? And it's not at the other end. So you have to use your good hand to hold it, but take your affected hand and try to thread it. Sorry, I have to steady my hand sometimes. And I cheated on that last one, so I'm going to use my right hand to push it all the way to the end. So this is a great tool for threading needles, doing things. I use it, okay, when, I probably shouldn't tell you this, but I use a screwdriver for to fix something, and this really helps use those things. So there's a pipe. The second thing is, or the third I guess, is you take a tweezer and you try to pick up the things, and we're going to put it in this cup with this little hole. See the hole I have to get in? Which is extremely hard, but and this works on pressure that you're using, like the clothespin, to close and open the tweezers, and it's also telling your brain when to close to pick up something. So I've used this too with coins and paper clips. I'll show you a paper clip. Paper clips are way harder. But now I'm doing it. Before I couldn't do it. And I get so frustrated and cry. And I mean, it's okay to cry. But when I did it, I celebrated. So the next thing I want to show you is the toothpick. So here's the toothpick. And what you're going to do is first try to pick it up because it's so small. It's hard to pick up. And then you're going to try to thread on it. So I take my bead, and again I try to sometimes when I breathe and relax and tell my arm to relax, my hand to relax, it works. So it worked. Okay. The next thing, which is extremely challenging, is the paperclip challenge. So I hope I explained this right. I know in my head what I need to do, but it's hard for me to explain it, I guess. So you hold one paperclip in your unaffected hand. You hold another in your affected hand and try to connect them. But use your right hand as much as possible. So it's picking up the paper clip, which is difficult, and then threading it and trying it again. I messed up some egg. Okay, and you keep doing this till you run out of paper clips. Now the challenge next is to undo them with your right hand. So hold with your left and disconnect with your right. Plus, this is challenging for me because I also have double vision. So, not to pat myself on the back or nothing, but I can't really see it good enough. The stroke affected my sight somehow, and I really can't, I don't have depth perception or spatial recognition, so learning to sit was challenging because I didn't know where the chair was, that's spatial. And depth, I didn't know how far it was that I had to lean down. So I always had to hold on to something. I'm cheating again. So, and then I put everything back. I won't torture you until I get some of this stuff off. Okay, so the next thing is, I think I'm going to do the straw. So the straw, I had problems with my breathing. I couldn't hold my breath. I couldn't blow. I couldn't whistle. I couldn't talk when I walked. So this helps for me anyway. I don't know about anybody else. But for me, they use this to suck and blow because I honestly couldn't suck anything up. I couldn't have shakes. I couldn't have pop through a straw. Nothing. So this exercise helped me accomplish all that. And I'm happy to report I can do that stuff now. It's not good, but at least I can. So first you suck, and then you blow. And trust me, the sucking part made me cough and gag, and there were times that I couldn't breathe. It was really scary. But this exercise helped my, I don't know what you call it, esophagus or vocal cords or something, I don't know. But it helped it gain back the strength because it was paralyzed. Half the reason why I talk the way I do is because this is paralyzed. So this helps send life to it. It isn't perfect yet, but it's working. And now I'm happy to report I can suck and blow. That sounds horrible, but I mean I can have a shake. I can have a pop now with a straw. And I'm still working on walking and talking for some reason. I think because I'm focused so much on walking that I don't focus on my breathing and talking. So I get really winded and really, I just can't talk. So if I stop, I can talk. But if I walk, I still have problems talking. And I get really winded if I'm trying to do something other than just walk. So, excuse me. So the other thing is a deck of cards. So my occupational therapist brought this to me, and I didn't even know I couldn't do this, but I couldn't. So shuffling a deck is really extremely hard for people with brain injuries. And so it took a lot of practice. And I think actually my speech therapist, Allison, bought me a deck of cards, these deck of cards, so I can have them. I don't remember. Maybe Sarah gave them to me, but I don't remember. But, so remember, with your affected side only. So I would cut them and then grab them with my left hand. And then shuffle. It's not perfect, but I'm trying and I can do it. And someday I'll be able to reverse shuffle. But again, with your right hand or whatever your affected hand is, you cut them. I'm trying to, but I can't. But anyway, I practice with this. Again, this is so easy. You can do it while you're sitting watching TV, not in bed, because I tried it and cars go everywhere. But this is another tool. So the last thing is my hardest thing. I'm not gonna lie. This is the hardest because I haven't mastered it yet. But it's good therapy for my eyes because I have to watch where the ball is going. It's good therapy for my arm and my hand and my wrist because I'm throwing it up and I'm also catching it, however that may be. And hopefully I'll catch it on camera. But here he goes. Okay, that's it. Like I said, I haven't mastered that yet, but there you go. So I try to do those things. Oh, let me grab a pen. I forgot. Sorry. Okay, so the very last thing I try to do is write. So there are some easy exercises that my occupational therapist gave me in the beginning, and hopefully you can see this, and I'll try to narrate as I go, but it's really hard to focus and concentrate at the same time. But here we go. So the first thing she said was to do a circle, and keep doing circles all the way over. They look more like E's when I do them, but just to show you. Hope you can see that. Not so good. The next thing was squares. My squares. Well, the first one looked good. The second one, not so much, because of my tremors. But it's, and another thing she told me is, see, I hold my pen too tight. So there's another thing I have to remember is to release and relax when I'm doing it. But it's so hard because I get so focused that I squeeze. I can't even, like, hold a bottle of water because I choose to hold a bottle of water because with a glass I'm so afraid the pressure of me squeezing will break it. So I try to use plastic things to hold on to and drink out of when I'm using my right, because you want to use your right as your affected side as much as possible. So I'm going to show you my squares. Not so great. And then zigzags. So basically, I'm drawing a straight line right, and well, kind of straight to the left, to the right. I gotta relax though. And as you can see, that's not so good either. But at least I can do it now. Before it was just so jagged, and my tremors have gotten better, but they were really bad in the first part of it. So now I'm going to try to write my name. Because I use my left, and it is like I'm a kindergartner when I use my left. And they have tried weights on my wrist. They have tried balancing with a heavier pin. They have tried everything, and I still have troubles. So that kind of sucks. But at least I'm doing it, and I'm trying. And someday, I'll get it, and I'll be able to write like this again. I can't wait for that day. Okay, so I'm sorry this is taking so long. Since I can't write, I put down some stuff. So I hope you don't mind me referring to my phone a lot. But, okay, so emotional changes after stroke. Stroke patients may experience many emotions after stroke. Some are from the trauma of it. We're depressed, we're sad, we're angry because our lives got ripped away from us. But other emotions are from the brain. And so I really want to express to caregivers, don't freak out. They're not going to be like this forever. It might take a long time, but it's not forever. And we're going to get a handle on our emotions. So sometimes it's caused by grief, and it's called post-traumatic stress disorder. Because what we experience physically and emotionally is traumatic. It's traumatic for us, it's traumatic for others. But I mean, one day I was a single working mom that had it all. I can sing and dance and run and skip and ride my bike. And now I can't do any of those things. But I'm trying, and it's going to get better. So anyway, after that, I mean, you can understand. So it's called emotional lability pseudobulbar effect. Look at that. So I'm sorry if I butchered that name, but that's what it's called. Emotional liability is a post-stroke condition that causes uncontrollable emotions. I want you to hear that. It's uncontrollable. Often patients with emotional lability find themselves laughing one minute and crying the next. And honestly, we have no idea. And for me, I kind of don't remember doing that. But I did it because a lot of people tell me that I did it. This condition is also known as pseudobulbar effect. It occurs when there is damage to the emotion center of the brain. Your emotional control can become impaired when the areas of the brain responsible for emotions are damaged after stroke. Sometimes this condition often goes away on its own. And know that it goes away on its own sometimes. Spontaneous recovery. Other times, treatment for pseudo-bulbar effect is required. Then there's post-stroke depression. It's a feeling of hopelessness. It's frequent crying episodes, and agitation. We can get mad on a dime. We can cry on a dime. I just had an experience with crying that I couldn't stop it. Before, I could control my emotions very well. And then when I was alone, I would cry or get mad or whatever. But in front of a person, I could control it. Now I can't. So it was just a couple of weeks ago that I had an incident with my hair, because it may sound stupid, but my hair means more to me now than it did before, because I have control somewhat over what my hair looks like. And it came back blue, and it came back uneven. As you can tell, it's still kind of uneven. This side is longer than this side, but the quarantine, I can't fix it. So, but I cried. I cried to a close person to me, and she told me that I shouldn't cry. She understands that I should be upset, but she doesn't understand that it's bad enough to cry about. Well, now when I express something to somebody, I can't without crying, or if it hurts me, I cry, and I can't help it. If it's something sweet, like a dog or something, I cry. But I have no control over it. I can't hide my emotions anymore. So what you see is what you get. The third thing is anger. And I kind of remember some stuff, and some stuff I don't. This is horrible, but when I was in the hospital, they used to make me go down to the dining room in order to eat. I didn't eat if I stayed in my room, so I had to go. So I remember my uncle was there, one of my best friends, who isn't my best friend anymore because he's dramatic and toxic, and my son, who hasn't talked to me since. None of them have talked to me in 3 years. But anyway, they were all there, and they were being so wonderful, going, "Come on, Gay, just eat something. You don't have to eat a lot, just eat something." And I remember I flipped them off because I couldn't talk, I couldn't write, so I was frustrated, and I couldn't tell them that I didn't want to be there. I wanted to be in my room, sleeping and eating alone by myself. And so I do remember that. I guess when I got home, I was on my walker finally then, but not doing very good. And I remember going out into my deck because I have to go through them, my son and my uncle, to get to outside to the front. So I remember I went to my deck, which has 14 stairs on a walker, and I was going to try to escape, I guess. And I remember them coming out and trying to stop me, saying, "Please don't do this, please." And I remember getting really angry. And for that, I'm sorry. But again, had no control. I think that's stupid now that I did that. But I did it, and I'm so sorry for the trauma that I caused those two. Because they had to be scared out of their minds. But I still get angry, but it's getting better. Now when I get angry, I know I have a right to be mad. But what's changed in me is I don't say what's on my mind like I used to. I used to tell you like it was, whether you liked it or not. And now there's something inside of me that prevents it, but I still get angry. But it's getting better. Personality changes. I was an advertising consultant before this. I had no fear whatsoever about going in up to somebody I didn't know and introducing myself as starting a conversation. I was the first person to say hi, how you doing when we were walking or anywhere, at Walmart, the mall, whatever. Now, since the stroke, I have anxiety, severe anxiety. For a long time, I would keep my head down and not talk to anybody. And I think part of it is because I didn't speak so well. A lot of people think I'm drunk, which I'm not. For example, I went through the drive-thru at Carl's Jr. and I placed my order, and they forgot to turn off the speaker, and I heard them laughing and making fun of me. So that was hard, and I didn't go for about 2 weeks to another drive-thru. But shame on them. That's my attitude now. Shame on them that they made fun of me, that their parents didn't teach them that it's not nice, for not having, not pity, but sympathy for me. Whatever. But anyway, so there's my my doctor. So that was one of my changes in my personality. Behavior changes. People can have dementia. The demands that every therapy has on us, people don't understand. So please be aware that after we do physical, occupational, speech, therapy, whatever, we're tired. It takes a lot of mental energy for our brains to soak in what we learned. And that's why it's important for repetition, because the more you do it, the more your brain recognizes what you're doing. But a lot of people give us slack for naps, and it's physically, emotionally, and mentally tiring. And I wish more people would believe that. I ran into a lot of people that said, oh, you're just using that as an excuse. You use your stroke for excuse for everything. Well, I have a pretty good excuse. Right? But it's true. And it's very demanding. It's very focus-driven. And it takes a lot of brain power and physical power for us to do anything. So keep that in mind, please. Caregivers should be aware that the brain is working very hard to heal itself after stroke, and this can cause strange behavior. As long as the behavior is not self-destructive or harmful to others, try to exercise compassion, please, for your loved one. When behavior changes become destructive, medical and psychiatric intervention is needed. So, how do we cope with emotional changes after stroke? This stems from changes in the brain, in our brain, and the draining process of recovery, and it really is draining. It's important that friends and family exercise understanding and compassion for the loved ones. Emotional changes often go away on their own, but it does cause forgetfulness. It causes neglectfulness. Like if you tell me, okay, you need to do that before you go to bed, I'll say, okay, and it never happens. Well, I forgot. I literally, not like, oh, I'm Dizzy Blonde, forgot. I mean, I really forgot you said that. One person was telling me that they said something to me, and I'm like, okay. And then about a week or two later, they said, remember that conversation? I'm like, no. And they said, no, really, we talked about it. You said this and I said that. And I'm like, I have no idea what you're talking about. And it's not because I'm lying. It's because I really don't remember. I literally don't. So you might have to tell me something a couple of times or more before I'll get it. And the scary thing, my friend Jessica and I were talking about it, is somebody could make up something and say we did something and we never know. We think, yeah, that's probably true because we literally don't remember it. So, also, if a situation becomes hazardous to the emotional or physical health of the patient or the family, medical and or psychiatric intervention should be sought. I don't know what to say, fortunate, but fortunately, nobody had to do that with me. They just left. I'm all by myself. So, if I needed it, I didn't get it. But if it gets physical, because I do remember getting physical that one time out on the deck with my family, and they probably should have called somebody, because I think only a psychologist can help us deal with everything that we're going on, and also, too, they understand the brain process of recovering, and I just wish my family would have stuck in, and I hope they're watching now and seeing I'm way better than what I was. So that's it. I would love any questions or comments that you have, as long as they're positive, because this was really embarrassing for me. Really embarrassing. It's hard to show people that haven't had strokes or that you don't know what you deal with and what you've been dealing with and what you went through. And I showed a little bit of that today. Hopefully I'll get to show you my physical therapy part of it. And Allison, my speech therapist, has agreed to do an interview with me on Zoom, hopefully Monday. I've reached out to my physical occupational therapist and my neurodiafont. I haven't heard back from them yet, but hopefully they will do this channel too. And next time too, I'd like to show you my eye exercises because my left eye was all the way over there while this eye was facing forward, and I still have double vision, but it's getting better. So I'd like to talk about that and any other ideas that you guys have that you want me or Jessica to talk about. We would love that. We welcome that. So I love you all. Keep the hope, celebrate every victory, and we'll see you soon.